Hi everyone, Karen Roby and Tiernan Ray here for ZDNet, and we're talking today about during this pandemic. It's been really interesting to see how companies and different people are coming together, oftentimes changing their model, their business model, to help fight during this pandemic to get products out there and things out there that people need. Tieran, this article you put together really interesting about some guys that you caught up with in Italy, how they're helping. Take us back a little bit and tell us what you know about this.
Karen, we spoke to Cristiano Galbiati, who's a professor of physics at Princeton normally, but he also has an appointment in Italy. And when COVID entered into lockdown situation in Italy in early March, he was in Milan at the time. And he said that for several days, he couldn't function. He didn't know what to do with himself. He was under home quarantine. And he talked to a friend of his with whom he had worked on various projects, large-scale projects in physics, and they started talking about we should be able to do something about this. And so, no cocktail napkin sketch, but in one day, he and his friend brainstormed the idea for a cheap open source ventilator. The professor Galbiati got in touch with colleagues at Fermi Lab in the US in Illinois, which does particle physics work, and also in Canada. And they pulled together a team of 100 people, and they prototyped within days the design for a novel kind of ventilator. And they're now in production for that ventilator. Got the first 50 units, and the idea is to supply thousands of units in coming months to various parts of the world.
Wow, that's awesome. And it obviously they had some type of or talk a little bit about what they already had in process and the knowledge that was already there to help put them in a position to make those ventilator.
Kind of amazing because I don't know how much you know about ventilators. I do not know that much, but
Nope.
I learned from this that it's kind of similar to systems of pressured gas that these scientists had been developing. They had built a laboratory underground under what's called the Gran Sasso mountain range, which is like a belt of mountains that goes across the middle of Italy. And so for years, they've been working on building these giant chambers, tens and hundreds of meters high, and they're filled with pressurized gases. There's a whole complex system of piping that has to move gas through these chambers in a very precise way. And so Professor Galbiati explained to me, basically we had been developing over years a kind of giant lung system that has to have air coming in and out of it. And so we looked at this system of tubing, pressured gas, and we said, yeah, building a ventilator is kind of pretty much the same thing. It's on a much smaller scale. It also comes with different kinds of requirements because you've got to not harm a person. You've got to try to keep someone alive. So they were kind of taking all their scientific knowledge of years and years of working with these gases and highly sensitive instruments, shrinking it down, and then at warp speed, trying to build something that will safely do this process with a human being attached to it.
Yeah, that's the fascinating thing, is to see how they can ramp up production that quickly to meet the needs, the demand out there. And we've seen this in a lot of other companies we've talked about, and people who, I know we interviewed an orthodontic company that typically makes liners for teeth, and they're making vent parts. And I think that's been kind of the silver lining too, Tiernan, if you will, because we have to look for that sometimes, to see the spirit of people, how they say, okay, we can do this and we can do that, all just trying to make a difference.
And trying to navigate what goes on in a crisis where it's hard to reach people. Governments are completely occupied with activities. And in this case, Galbiati had to go around Italy getting certain permissions, getting certain special dispensations. He had to meet with doctors who are trying to save people and get tips from them. What should we be careful of in designing this ventilator to make sure it doesn't kill someone? And so all of this kind of legwork by people suddenly out of nowhere, that kind of work they'd never done before, transitioning from one life where you're an academic, you're building things over years at a very steady pace, to suddenly you are trying to gather information like a reporter in ways you never had to before, and then also trying to hand off your designs to manufacturers and hope that it comes out the way you spec'd it. It's amazing.
Yeah, absolutely. And what I know you just recently talked with him again. So the point they're at right now, they've already made about 50 of them, but that they expect to make even more. Not we're not certain how long this is going to go on or how many ventilators will actually be needed, but they're planning for the future, certainly.
Yeah, I asked Albiati about the fact that there's been varying opinions about ventilators. There's been people concerned that ventilators can aggravate COVID-19. Um, he's careful to say that he's not a doctor and he can't give medical advice, but what he is told by doctors in his consultations with them is this is still a very important last resort for patients. And Albiati's worried, as many people are, about a second wave in the fall and the winter when the weather cools again. And so, for the time being, he and the team are focusing on making sure they continue to ramp production. They have 50 units that they've built so far, and the expectation is in coming weeks they will get up to a level of hundreds per week manufactured, possibly as many as 1,000 per week manufactured. And so they're really proceeding full speed ahead to make sure that if COVID-19 is something that sticks around for a while, that this will be something that can really amplify healthcare's capabilities and be there for patients to the extent that it's needed.
Yeah, definitely. Good to know. At least we'll be, prepared for whatever may come. Well, Tiernan, I know you're staying in close contact with them, so it'll be interesting to see how this evolves and where this takes them. So the full article, of course, and I know an update even to that, all on ZDNet. And we thank you for that, and hope all you guys will check it out as well. Thanks for watching.